Good morning, everyone.
Morning.
Welcome to the Cabinet meeting. I am Councillor Andrew Husband, Leader of Durham County Council and Chair of this meeting. This meeting is being broadcast live through our YouTube channel. Before we commence with today's formal business, I would like to cover some of the housekeeping rules, issues for us all to follow. Please switch off or make silent your mobile phone and all other devices. Keep microphones switched off at all times unless invited to speak by myself as the Chair. When invited to speak, please switch on the microphone nearest to you and introduce yourself. Before we start, I would like to record that I received apologies from Councillor Tim McGuinness, who had a long-standing arrangement which predates this election and therefore cannot be here today. Thank you. Moving to item 1, public questions. There's no public questions received, so we can move on. Item 2, minutes. Since this is the first meeting of the new Cabinet, Cabinet members were not at the last meeting on the 9th of April 2025. Therefore, rather than agree the minutes, can we accept them as a record, a correct record? And can I have a mover and a seconder, please?
Thank you, Chair. I'd like to move the minutes.
And could I second them, please?
Thank you. Does Cabinet accept that the minutes of the last meeting are a correct record?
Agreed.
Item 3, declarations of interest. Are there any declarations of interest from members? Before we move into the substantive part of the agenda, we have received 2 questions on item 4 and 1 question on item 5. I will ask officers to present the reports and then invite the questioners to put their questions. The relevant Cabinet member will then respond. Please note that there is no provision for supplementary questions or discussion respect of the answers. Item 4, Health Protection Assurance Annual Report, June 2025. Can I invite Amanda Healy, Director of Public Health, to present the report?
Thank you, Chair, and good morning, members. The purpose of the Health Protection Annual Report is to update on activities over the course of the last year and provide assurance on health protection issues. You'll see in the papers there's a front short report, then there's a main report that we can use with our partners, because a lot of our work is dependent on partners, and then there is a data document with publicly available data. In the executive summary, you will see that health protection is a statutory responsibility of the local authority, had a responsibility to protect and improve the health of our local population, discharged through the Director of Public Health role. Health protection does what it says on the tin in many respects, protecting our residents from a range of diseases and hazards, and helps us to prevent and respond to those to keep our residents safe. It's often delivered by others, but the local authority receives public health grant for health protection and the purpose of protecting people locally. The annual report uses case studies throughout to show the work that's taken place over the last year, and it also covers the key elements of health protection: screening, immunisation, outbreaks and communicable disease, statutory regulation, and emergency planning and response. Some key achievements in the last year based on good partnership working include the increase in our screening uptake for our bowel screening programme up to 74.9% compared to 71.8% last year. We're also really delighted to be the 3rd local authority highest in the country for our uptake of the measles, mumps and rubella vaccination, and we've been recognised for this work at a regional level. We've also over the last year seen an increase in our chlamydia and HIV testing and a response to a range of outbreaks, and some of this I'll go into more detail on. And we've also seen some specific work on air quality and adverse weather. What I'll go through the report and then I'll come back to the recommendations and some key areas for assurance in the coming year, Chair. So in terms of the main report, you'll see in the introduction that we do engage with a range of partners, including our NHSE colleagues, our UK Health Security Agency and our Integrated Care Board, and that's drawn together through our Health Protection Assurance and Development Partnership. And as I said, we utilise our ring-fence grant, but a range of other funding that comes down through those other routes to the NHS and UK Health Security Agency for health protection measures. We also really try and focus on what good looks like and ensuring that we are aiming for the best in terms of health protection for our local population, and also ensuring that health protection arrangements are in place for all of our residents and some of the inequalities that exist within that. In section 3, page 10, you'll see more detail on screening and immunisation. This is predominantly the responsibility of NHS England, where we have a responsibility to have assurance that the right measures are in place and that our local population is supported in terms of screening and immunisation. I'm really delighted that our newborn and infant physical examination level is at an extremely high level in the last year, and that's delivered through our local foundation trust. From our immunisation point of view, again, a lot of that is responsibility of NHS England, but it's also delivered locally through our GPs, through our school-based immunisation teams, and we work very closely with colleagues in relation to immunisation, which is obviously a very effective public health intervention. Across our immunisation programmes, of which currently there are 13, but it changes quite often in terms of children's preventable from preventable diseases, we have got some very high vaccination rates, which is really positive. All of our vaccination rates are over 95%, other than measles, mumps and rubella second dose. We've done a lot of work with our adolescent vaccination uptake, and you'll see in the report a case study working with the provider IntraHealth, but working very closely with our schools and our head teachers and the administration within schools and our local parents to engage with teenage vaccinations in particular. There are some areas for improvement, including meningococcal and also additional support for our children in care, where our vaccination rates are just slightly below the North East average of 82% and ours at 79%. We support the flu vaccination programme on an annual basis, and we have very high uptake, although we'll see, similar to other parts of the country, that this is reducing over time. We've got some dedicated work, particularly with our 2- and 3-year-olds, offering vaccination in a nursery setting, so it makes it as easy for parents as possible to receive their vaccination for their child. And we also offer a programme for our frontline staff and our staff within the council, potentially protect their health during the winter period. Our older adult uptake, and particularly within our care home settings, is very good, and that includes for flu, but also pneumonia, shingles and COVID. The next section of the report sets out how we prevent communicable diseases and how we manage outbreaks. So a lot of this is led by UK Health Security Agency. We have a colleague, a consultant in public health, who works very closely with us. However, we also have some fantastic internal staff with our environmental health officers, and linking very closely across the council, depending on the nature of any of the disease. The last year, you'll see in the report, has actually been quite a busy year, where we've had a range of communicable diseases, including invasive group A streptococcal in one of our large nurseries, working very closely with the nursery parents, NHS England, the Integrated Care Board, to mitigate the risks of that and to ensure that the outbreak is brought to a close. Avian influenza and things like whooping cough. The case study here is the work that we do on a daily basis with our adult social care colleagues and our care homes in particular, where we're particularly working with those vulnerable older population, and we have a dedicated infection prevention control team that looks at trying to ensure we've got good control measures in place, but also able to respond very rapidly. We also work closely with our university, with the prisons and the migration partnership in relation to some of the communicable diseases. Our local trust is working hard to try and ensure that our healthcare acquired infections are kept to a minimum, although we're seeing nationally an increase in these, which is a challenge. For sexual health, of which the local authority receives a dedicated grant, we have good local sexual health services. We've seen an increase in sexually transmitted infection testing and HIV testing. Our levels of sexually transmitted infections remain lower than national average, although they have increased slightly. And we're seeking to improve late testing for HIV and increase chlamydia detection. We work closely on antimicrobial resistance too, particularly with our colleagues from a pharmacy perspective, and you will see again in the full report that we've been nominated for a national award for some of this work. Our work from section 6 and page 33 is the protection from environmental hazards. That could be something locally, such as a major oil spillage, which would result in a smoke plume, which might have contaminants which would be harmful for health, or it could be longer term impacts, human impact on the environment, or vice versa, such as adverse weather, for example. And you will see example in there from last year where we were working closely with one of our schools in relation to radon and with our health and safety colleagues locally. The case study there is our work at Hordern Together, working closely with our colleagues within community protection and housing on protection of health in relation to Hordern Together. The final section is around the preparedness for emergencies on page 36, and that's where it's really important to have senior members of the council trained in emergency preparedness, and examples within there are some of our work on our adverse weather, excess deaths, particularly during the winter period, and the case study is our joint work with us on winter wellness, preparation for winter with our partners, including our local trusts, the Fire and Rescue Service, and particularly our local communities, so people can be as prepared as possible for storms or for outbreaks during the winter period. We have our local civil contingency unit, and that also then helps us with that coordination and planning for any particular emergencies. And certainly over the last year, that has included a range of exercises, and this year there is a national exercise on pandemic planning which we will be actively taking part in. But all of this is really dependent on working very closely with our community so they can improve their own resilience from a health protection point of view. In terms of going back to the front report, to just round off, we have identified, as I say, it's our role to be assured of those arrangements, and I think we have strong arrangements locally for health protection through our partnership arrangements, but we do have some areas for improvement and further assurance during 25-26, which is a bit of a review against our What Good looks like, health protection documents, to ensure that we are completely up to date with everything, to ensure that we are supporting and providing some governance of the delivery for childhood immunisations project, working with our Children and People Services colleagues to look at our children in care and vaccination uptake, work within the Sexual Health Service and the key partners to increase HIV testing, and to actively participate in the National Pandemic Preparedness exercise later in the year. Members, Cabinet, the recommendations are set out in paragraph 10 of the report and run through from noting the report to some collaborative arrangements, particularly the changes that we're seeing currently in the NHS, and ensuring that we are working very closely with those to keep the statutory responsibilities really close and ensuring that they are actively taking place, and supporting efforts to address the identified areas for improvement. That will take place over the course of the year. And so, Chair, that concludes my presentation of the report. Thank you.
Thank you, Amanda. We've received 2 questions on this item from Mr. Chris Hood. Mr. Hood?
Thank you, Chair.
Can I invite you to ask both of these questions, please?
Thank you, Chair. Based on the new administration's election manifesto, their narrative since the May 2025 County Council election, and in the first month of their leadership regarding particular members of our communities, please can the relevant Cabinet member confirm that this Council will continue to offer an equal and equitable service to all residents of this county?
And question 2.
Can the relevant Cabinet member please confirm that the new administration is committed to addressing public health issues resulting from the effects of climate change as detailed in the latest Climate Emergency Response Action Plan, as per paragraph section 2.1g of the report, also outlined on page 29 of the agenda papers or page 9 of the report?
I would like to thank Mr Hood for the first of two questions, of which I'd like to answer the first one. Our message has been consistent, be it during the election and during our first month in office. We will continue to observe, to consult, to identify savings and efficiencies with the ambition to provide equal and equitable benefit to all residents of the county. Councillor Brown, Cabinet Portfolio Holder for all Adults and Health Services, can I ask you to respond to Mr Hood's second question, please?
Thank you, Chair. Yes, again, I thank Mr Hood for the question and the opportunity to clarify any misunderstandings. The County Durham Health Protection Assurance Annual Report covers the period 2024 to June 2025 and encompasses relevant policies, actions and assurance over this time. The protection of health of the population of Durham is a statutory responsibility of this local authority and one of the 5 mandated responsibilities as part of the Health and Social Care Act 2012. I can confirm that this new administration is committed to addressing public health issues faced by our communities, the County Durham Health Protection Assurance and Development Partnership, the Director of Public Health, to fulfil their statutory role and report health protection arrangements through the Health Protection Assurance Annual Report, as tabled at this meeting. And again, I can provide assurance that health protection work will continue to protect our communities. Thank you, Chair.
Thank you. Please can I ask Councillor Brown to move the recommendations in this report?
Thank you, Chair. Health protection is a statutory function of the local authority. Within the Health Protection Assurance Annual Report 2025, the Director of Public Health has provided details of the range of work that has taken place over the last year, including surveillance, prevention, planning and responses with all services to reduce the harm from health issues to our residents. The report also identifies areas of concern and risk where further development and assurance is required in the coming year. The report clearly demonstrates the strength of the partnership relationships across the system, including the UK Health Security Agency and NHS England, as well as other council and local authority healthcare services. I would like to highlight some of the key achievements this year, including the improved uptake across the number of screening programmes. For instance, there has been a 2.7% increase to 72.1% in the breast screening programme. Screening programmes help our residents to assess diagnosis and treatment as early as possible. I also commend the collaborative work by Public Health, the Infection Protection and Control Team and Primary Care. Working together with adult social care, they ensure the effective delivery of vaccination programmes in our 96 care homes and provide clear advice and guidance to stop and respond quickly to the spread of infections in the homes, including flu, gastrointestinal infections and scabies. This work protects those who are often most vulnerable from risks to their health and well-being. I note the areas of development for the coming year, including ensuring continued health protection assurance during times of change for key partners, e.g. NHS England and the Integrated Care Board, and continue to improve access and uptake of HIV and other testing via our sexual health services. I welcome the recommendations to improve health outcomes for the residents of County Durham. I am happy to propose the report. Thank you, Chair.
Thank you, Councillor Brown. Can I invite Councillor Hunt, Cabinet Portfolio Holder for Children and Young People's Services, to second the recommendations in the report?
Thank you, Chair. I am pleased to be able to speak on this report. Protecting the health of our residents is of the utmost importance and is wide-ranging, as can be seen in this report. I am pleased to acknowledge the broad assurance that effective processes are in place for each of the key elements of health protection. I note the significant efforts across partners to maximise vaccine uptakes amongst pregnant women, young children and adolescents to provide protection for children and families from infections and diseases. This year, partners responded rapidly to an infectious disease outbreak in a County Durham nursery. An incident management team was quickly convened and coordinated the delivery of antibiotics to over 270 children and 60 staff, and the also appropriate vaccination to all eligible children. This protected children and adults from further spread of the disease. The report also highlights the majority of County Durham childhood immunisation programmes exceed national standards and averages. County Durham was the highest local authority in the North East and the third highest local authority in England for 2 doses of measles, mumps and rubella, the MMR vaccine. I also note the successful planning and delivery of the targeted 2 to 3 year flu programme delivered in nurseries in areas with the lowest uptake, and commend the innovative practice. 412 vaccinations were given at these clinics, helping County Durham to achieve 2 to 3 year old vaccine coverage that was significantly higher than the England average. However, I am concerned to read that there has been a reduction in the uptake of 3 of the 10 childhood vaccines, 0 to 5 years. These have dipped below the required 95% coverage for herd immunity. The recommendations in the report identifies action to be taken, and it will be important to see these changes in the coming year. I am happy to second this report.
Thank you, Councillor Hunt. Are there any other Cabinet members wishing to speak? Thank you. Does Cabinet agree the recommendations? Agreed. Thank you. Item 5, Best Value and Corporate Peer Challenge Improvement Plan Progress Report. Can I invite Steve Evans, Head of Corporate Affairs, to present the report, please?
Thank you, Chair. Good morning, everybody. I'm Steve Evans, Head of Corporate Affairs. The report sets out the Council's approach to continuous improvement. The purpose of the report is threefold. Firstly, to provide a summary of the Council's approach to continual improvement, particularly in relation to best value standards. Secondly, to inform you, as a new Cabinet, about our participation in the Local Government Association's Corporate Peer Challenge, which is scheduled for week commencing the 6th of October 2025. And thirdly, to update you on our preparations for this challenge and our self-assessment against the best value standards. Durham County Council is committed to maintaining its strong reputation for delivery and performance. Our effective governance allows us to be confident in our operations, while our focus on continual improvement ensures that we are not complacent. We have enhanced our corporate performance reporting and engaged in a self-evaluation process aligned with the Government's recently revised best value standards, ensuring our operations are efficient, effective and economically sound. This includes preparing for the Corporate Peer Challenge to gain further insight and support for our improvement efforts. The Corporate Peer Challenge in October will come around 6 months after the change of political leadership in the Council. The timing is helpful and will provide both members and officers with early external peer perspective on leadership and progress towards setting and meeting the administration's new objectives. Despite facing financial challenges which are addressed in our medium-term financial plan, we have a proven history of robust financial management and positive audit outcomes. We also welcome external evaluations and peer reviews from organisations such as the LGA, CIPFA, Ofsted and CQC, which are referenced in the report and which help us benchmark our standards against other councils. It's worth noting that our performance has been assessed as strong in all of these areas. Whilst we are confident in our performance, we remain vigilant and committed to continuous improvement, ensuring that we meet the evolving needs of our community and uphold the highest standards of public service. Paragraphs 70 to 73 set out a summary of our self-evaluation findings and progress towards driving this improvement. Cabinet is requested to note the content of the report. Thank you.
Thank you, Steve. Councillor Mark Wilkes has submitted a question in respect of this item. Councillor Wilkes, would you like to ask your question, please?
Good morning, officers. Yes, thank you, and Cabinet members. And can I wish our new Cabinet members well in their roles? I'm minded when I started as a Cabinet member just how much work is involved, and also how much we must treat everyone, including all of our staff, equally and respectfully. And I trust that will continue with the new administration. As Cabinet will be aware, you're updating today on the peer review the previous administration commenced to ensure this council continues to improve and to be one of the most effective in the country. In relation to the climate action statements, the previous administration I was part of was able to make the council compliant in relation to all areas of climate action as detailed in 1D of the peer review statements, and our low carbon team has achieved some amazing positive benefits for our council, our communities, our county and businesses. This has generated huge savings for the council and helped to secure millions of pounds of grant funding. Given all of this, can Cabinet confirm that it is committed to continuing the amazing work of the low carbon team in cutting emissions, improving the environment across County Durham and saving millions of pounds for this council and indeed doing so much more? Thank you, Chair.
Thank you, Councillor Wilkes. Councillor Allison, Portfolio Holder for Neighbourhoods and Environment. Please could I invite you to respond to Councillor Wilkes' question, please?
Thank you, Chair. Thank you, Councillor Wilkes, for your question. So the three parts to this question which I hope we can address. Reform were elected with a mandate to review net zero and to identify efficiencies and savings for the people of County Durham. We're currently reviewing the claims of carbon reduction within County Durham, whilst requesting Council considers the carbon creation of mining, production, transportation and disposal at end of life of renewable technologies. We will then have an accurate picture of the true measure of the success so we can make an informed decision. To answer parts 2 and 3, we take the environment seriously and are already discussing projects that include forestation, protecting wildlife and biodiversity, and also how renewable energy technology may impact our local environment, which often gets overlooked. Efficiencies and savings are already being identified, which we are hoping to announce soon. We are analysing consumptions, the impact of energy costs of home working, along with the changes to the scale and usage of our asset portfolio. And at this point, we will then also be in a position to make an informed decision. Thank you, Chair.
Thank you, Councillor Allison. Can I thank Steve and his team for the report? I also want to put on the record my thanks for the work of officers from across the organisation and their dedication to ensuring this council continues to perform strongly. As the newly appointed leader of the council, I am pleased to see a focus on continual improvement. This is something that goes to the heart of the new administration's plans for this council. We were elected to ensure the taxpayer receives value for money. In line with our commitment to the electorate, this administration will be taking a close look at new opportunities to deliver on this commitment. We are already in discussion with the senior officer leadership about how we will achieve this. This joint approach extends to the process of bringing our Department of Local Government Efficiency into the council to audit the books. I am particularly pleased to highlight our upcoming participation in the LGA, Local Government Association's Corporate Peer Challenge. I am keen that both DULGE and the Corporate Peer Challenge provide the new administration with detailed insights into how and what we might do differently in pursuit of our ambition to eliminate waste. Although the priorities of this administration don't fully align to some of the best value standards, for example in relation to equality and diversity or climate change, the framework is useful in assessing the match fitness of the organisation. By rigorously testing ourselves against these standards alongside the work of DULGE, the administration will ensure that our operations are efficient, effective and waste is eliminated. This commitment not only helps us deliver the best possible services to our community, but also reinforces our accountability and transparency. Cabinet is asked to take note of the content of the report. Are there any other Cabinet members wishing to speak? Can I ask Cabinet to note the update? Item 6, exclusion of the press and public. Items 7 and 8 contain exempt information and therefore a resolution is required to exclude the press and public from the meeting at this point. Can I have a mover?
I'll move that, Chair.
And seconder?
I second that, Chair.
Does the Cabinet to agree the resolution to exclude the press and public? That concludes the public business for this part of the meeting. I would like to thank everyone for taking part and to those members of the public and media who have watched this meeting.